Dr. Brian A. Iwata, His Contributions to Functional Analysis and Interventions of Problem Behaviors. A summary and presentation by Brian Kuhn. Who is Dr. Brian A. Iwata? You may have seen his name in our book. Oftentimes when we're reading about functional analysis and the function of behaviors, Brian Iwata's name comes up in the citation. He is currently a psychology professor at the University of Florida. This is his email. Iwata and his staff at Western Michigan University wrote and published the Functional Analysis Screening Tool, or the acronym FAST, for helping to determine functional behaviors. His primary focus is on functional analysis of behavior and working with demographics who emit severe problem behaviors and self-interest behaviors. He believes the accolades of his students to the field is his greatest contribution. And over 1,000 studies have been replicated of his use of functional analysis. Here are some examples of self-interest behaviors, or SIB. I'm starting with self-interest behaviors because it's primarily the main focus of Brian Iwata's work. It's what he's most famous for. Brian Iwata's work with students and adults with self-interest behaviors. In 1974, Iwata joined a team at Western Michigan University who worked with a sample of severely intellectually disabled adults. The adults exhibited severe self-interest behaviors, often referred to as the forgotten demographic. The sad thing is that they're considered the forgotten demographic because being that they had severe developmental disabilities and severe self-interest behaviors, many teachers and researchers and therapists didn't want to work with them because they're just too difficult of a subject to work with. Using functional analysis, Iwata and his staff were able to learn the reasons for the severe behaviors and treat them accordingly. Iwata's interventions are often replicated by other researchers when dealing with SIB within problematic demographics. This next section slide is taken from an article about the functions of self-interest behaviors, a study led by Brian A. Iwata. Over an 11-year period, Iwata and several other researchers worked with a sample of 152 cases with severe intellectual and developmental disabilities. Data was collected from approximately 4,000 experimental sessions. Functional analysis methodologies not only help with identifying functions, but also determining possible interventions. Results for the functions of behavior for SIB were as follows. Escape or negative reinforcement made up 58 total cases, or 38.1%. Social positive reinforcement, or attention, was 40 total cases, 26.3%. Automatic reinforcement, or sensory behavior, was 39 total cases, 25.7%. And finally, 8 cases were controlled by multiple variables for just 5.3%. Now, multiple variables might include items within the environment that reinforce behavior, or probably a combination of the functions above. Functional analysis of problem behavior. This section is taken from a video lecture presented by Brian Iwata at Western Michigan University. What are the common functions of behavior as they relate to problem behaviors? Iwata claimed that all problem behaviors are learned and reinforced by some kind of antecedent or consequence. Functions of behavior are as follows, according to Iwata. Social negative reinforcement, escape from task. Sensory, automatic reinforcement. Positive reinforcement, often reinforced by attention and access to materials. When should functional analysis be used? If the target behavior is merely annoying or mildly disruptive, functional analysis is not necessary. If the target behavior is an SIB that causes tissue damage or disrupts the environment completely, then functional analysis is often needed. Steps when doing assessment for functional behavior according to Brian Iwata. Using a rating scale such as a FAST with the caregivers or parents or other therapists. Direct observation within the natural environment and several other environments. Looking at variables that may be affecting problem behaviors, further assessment as needed. Often these variables include stimuli within the environment that need to be isolated. Descriptive analysis versus functional analysis. Descriptive analysis is the initial part of functional analysis where the environment and the antecedents are observed, but there's no functional analysis. Descriptive analysis is a structural observation of antecedent behaviors, a what but not a why for figuring out behaviors. It cannot be used to identify function of behaviors, and not all responses are reinforcing. Some are incidental. Functional analysis is considered to be the gold standard for behavior analysis according to Brian Iwata. It identifies the function of behaviors, focuses on consequences that teach behavior, and focuses on variables within the environment and removes those that are reinforcing to the maladaptive behaviors. So often Iwata and his staff would have the subject within an environment, and if they believed that a certain stimuli would be reinforcing that target behavior, then they would isolate that part of the environment just so they'd be affected by that one particular stimuli. But if that was determined not to be a function of behavior, then they would move on to a different stimuli within the environment and isolate that instead. According to Iwata, real functional analysis is not easy and can take up to 4 to 6 hours to observe a subject in all their natural environments. So if you're not willing to put in the time, 4 to 6 hours per subject, then you're not really going to be able to do functional analysis. Fast. Not perfect, but pretty good. What is a functional analysis screening tool? 3 parts. Functional analysis screening tool is a summary of the client's behaviors in relationship to caregivers. And the second part is the 16 questions outlining relation of target behaviors to functions of behavior. Finally, it's a scoring summary that adds up all the attention, escape, and automatic sensory stimming or pain relief scores to figure out what the function of behavior might be. Now, this is an example of the form that was originally created by Brian Iwata and staff at Western Michigan University. The one you might have used in your sessions might look a little bit different. The advantages of FAST are a well-informed amount of questions that paint brief picture of behaviors and antecedents, coupled with observation that can be successful for building foundations for behavioral analysis. The limitations of FAST: it cannot be used solely for functional analysis because of issues with reliability. And the observation is objective, but memory issues with caregivers can make behavior identity subjective. Oftentimes you'll find that the caregivers or therapists, if they're not experienced, may not remember the exact antecedent that caused the target behavior in that moment, so they might kind of come up with stuff subjectively rather than objectively. It's probably up to the clinician to observe the environment for a time and then use a FAST so they can possibly fill in the gaps that the caregiver or the inexperienced therapist might leave out. Another article I read that I thought related well to the content of what we learn in class, preferably about the problems with extinction. Now, you might be familiar with the term extinction burst. Oftentimes, if you have a client who has some disruptive behaviors and the function of that behavior you and the licensed behavior analyst of your case have determined is, say, attention, then you remove intention from the environment, you're likely to put that behavior on extinction. However, at that very moment, there'll be an extinction burst where the behavior will frequently occur and cause sometimes a lot of grief to the caregiver. From the journal article by Brian Iwata and other researchers from spring 1999, Problems with Extinction and How They May Increase SIB and Aggressions. Demographics sampled were young adults and older adults with developmental disability disorders and autism spectrum disorder. Trying to place SIB or aggressions on extinction can cause an extinction burst or an increase in aggressive behaviors. However, when paired with positive reinforcement procedures or differential reinforcement of other behaviors, there's less of a chance for extinction bursts. 62%, that's 13 out of 21 of the subjects experienced extinction bursts when only extinction was used, whereas only 15%, that's 3 out of 20 subjects, saw extinction bursts when extinction was paired with differential reinforcement and positive reinforcement. In conclusion, pairing extinction with other interventions is the best case scenario based upon the sample tested within the article. In conclusion, Iwata's behavioral analysis and functional analysis is still used today by many researchers and clinicians. As I mentioned before, he's still teaching psychology at the University of Florida. The work that he'd done in the past with the Western Michigan University, there's a link for that for the Center for Autism Excellence at WMU, and I provided the address here. There's also a lot of other great videos on YouTube if you just happen to look up his name. I mentioned before that Iwata's greatest contribution, he considers his greatest contribution to be the work his students have done. 9 out of 22 of his 9 out of 22 of the recipients of the B.F. Skinner Young Clinician Award were awarded to Brian Iwata students. And in 2015, the APF, which is the American Psychological Foundation, gave him the gold medal and the teaching award for lifetime achievement in the application of psychology. So the work that he's done with in regards to self-injurious behaviors and problem behaviors has been very beneficial to behaviorism and to all behaviorists. What can we learn from Brian Iwata? Well, if you really want to learn, you can watch his videos on YouTube, especially the ones about functional analysis, which he said is the gold standard of figuring out behavior within the environment. My own takeaways from learning about his work, well, I've used the fast sheet within my sessions, and just recently I did a worksheet for determining preferential toys within for my client, and it turns out that Brian Iwata actually designed this worksheet as well. So when you're dealing with lots of problem behaviors and motivating operations, if your client knows that they might be getting their hands on some really cool toys that you learn about using one of these sheets, then you might be less likely to see SIB or problem behaviors within a session. I'm very much interested in learning more about functional analysis and Brian Iwata's work. I've come up with a bunch of different journal articles, and because he's written so much of the parts in the book by Cooper, I will continue to learn from him. Thank you very much. This has been my presentation. This is the bibliography. If you have any questions, I can be reached in class. Thank you so much for your time. Bye.